Get clarity on the CNA passing score requirements to confidently prepare for and successfully pass your CNA exam. The CNA certification exam includes two key components, the written exam and the skills test. Each part of the exam has specific passing score requirements that candidates must meet in order to become certified. Understanding how these exams are scored, what constitutes a passing score, and how to interpret your score report is essential for exam success. This lesson will guide you through the passing score requirements, helping you understand what you need to achieve to pass the CNA exam and become a certified nursing assistant. Understanding the passing score for the CNA exam. Written exam scoring. Scoring scale. The written exam is scored based on the number of correct answers you provide. The exam typically consists of 60 to 100 multiple-choice questions, and you must score at least 70 to 80% of the total questions correctly to pass. How the score is calculated. Your score will be calculated based on the number of correct answers relative to the total number of questions. For example, if the exam consists of 80 questions, you must answer at least 56 to 64 questions correctly to pass, based on a passing score of 70 to 80%. Skills test scoring. Pass or fail evaluation. The skills test is a pass-fail test where you are asked to demonstrate several essential CNA tasks, such as hand washing, patient transfer, and vital sign measurement. The exam proctor will evaluate your performance based on a checklist of specific tasks. Scoring method. Each skill is evaluated using a pass-fail system, and you must demonstrate each skill correctly to pass. In some cases, partial points may be awarded for correctly completing parts of a task, but the overall evaluation will focus on whether the skill is performed safely and correctly. Failing the skills test. If you fail a task during the skills test, you will be given a chance to retest the skill before leaving the exam center. Overall passing criteria. To achieve certification, you must pass both the written exam and the skills test. Written exam, achieve a score of 70 to 80% correct answers to pass. Skills test, demonstrate proficiency in all the required skills with a pass or fail result. Full certification requirements. To be fully certified as a CNA, both parts of the exam must be passed within the designated testing period. Failing one part of the exam will prevent you from obtaining your CNA certification, even if you pass the other part. Example: if you pass the written exam but fail the skills test, you will need to retake and pass the skills test in order to receive certification. Interpreting your CNA score report. After completing the written exam and skills test, you will receive a score report that outlines your performance in each section. Understanding how to read this report is essential for knowing whether you've passed and what areas may require improvement if you need to retake any portion of the exam. Written exam score report. The written exam score report will provide 1. Total number of correct answers. This will indicate how many questions you answered correctly. 2. Overall percentage score. This percentage reflects how many questions you answered correctly out of the total number of questions on the exam. 3. Pass or fail status, a clear indicator of whether you passed or failed the written exam. Skills test score report. The skills test score report will provide 1. Pass or fail status. Indicates whether you passed or failed the skills test overall. 2. Specific skills evaluation, a breakdown of each skill you demonstrated during the test, showing whether you passed or failed each one. 3. Comments from the proctor, feedback on your performance, particularly if there were areas where improvement is needed. What happens if you don't pass the exam? If you do not pass either the written exam or skills test, don't be discouraged. Many states allow you to retake the exam after a certain period of time. The specific rules for retaking the test will vary by state, but here are some general steps. Retaking the written exam. If you do not pass the written exam, you can generally retake it after a waiting period, typically a few weeks. Be sure to review your study materials and focus on the areas where you struggled during the first attempt. Test registration. You will need to re-register for the exam through the testing agency, paying any associated fees. Retaking the skills test. If you fail the skills test, you will need to schedule a retake with the testing center. You may be allowed to retake only the specific skills that you failed, rather than the entire test. Prepare for the retake. Review the skills you were evaluated on, practice each one thoroughly, and ask for feedback from your instructor if needed. Additional support. If you have difficulty passing the CNA exam after multiple attempts, consider seeking additional study support or test preparation courses. Many programs offer practice exams, study groups, and other resources to help you succeed. Summary of key concepts. Here are the topics and key points. Written exam passing score. Achieve 70 to 80% correct answers to pass the written exam. Skills test. Passing criteria. Pass-fail evaluation for skills like hand washing, patient transfer, and vital signs. Overall certification. Both the written exam and skills test must be passed to become certified. Retake process. If you fail, you can retake either part of the exam after a waiting period. Conclusion and recap. In this lesson, we discussed the passing score requirements for the CNA exam, including the minimum scores needed to pass both the written exam and the skills test. We also reviewed how to interpret your score report and the process of retaking the exam if needed. Understanding these requirements and how to interpret your results will help you stay on track toward becoming a certified nursing assistant.